Welcome to Precis Pharma. Today in this video, we will discuss drugs for peptic ulcer. Before knowing this, we need to know what is peptic ulcer. Peptic ulcer. Peptic ulcer. Peptic ulcer disease is break in the inner lining of the stomach. Then the cause of peptic ulcer. Peptic ulcer result probably due to imbalance between aggressive factor and defensive factor. So, what is aggressive factor? Aggressive factor means which is secreted from our body. That means acid, acids, pepsin, H. pylori, etc. And defensive factor means mucus, bicarbonate, etc. If the defensive factors level is high and aggressive factors level is low, it may cause ulcer. And the opposite of it means the aggressive factors level is high and defensive factors level is low. It also causes ulcer. And the another reason of ulcer, excessive use of alcohol, tea, coffee, certain drugs like corticosteroid, reserpine also cause ulcer. Mainly peptic ulcer. Mainly ulcer are classified into two groups. One is peptic ulcer and another is duodenal ulcer. Duodenal ulcer is the most common ulcer in recent time. Duodenal ulcer. Duodenal ulcer, it is the most common ulcer. It is the most common ulcer, duodenal ulcer. Now, regulation of acid secretion or HCl secretion means how HCl produce in our body. Firstly, HCl is secreted by gastric parietal cell due to activation of hydrogen potassium ATPase pump, and it's stimulated by histamine, acetylcholine, and gastrin. How it works? Firstly, gastrin, which is present in our body, gastrin activates CCK2 receptor, which increase calcium level in parietal cell, which is responsible for the activation of protein kinase or proton pump, which secreted HCl in our body. Then acetylcholine. Acetylcholine activate M2 receptor, which increase calcium level in our body, which is further increase protein, which activate protein kinase, which is responsible for the secretion of acid in our body. Same mechanism here, histamine, which activate H2 receptor through cyclic AMP, and which active protein kinase and increase the acid secretion in our body. Here, the pump was in resting mode. Then all the things, gastrin, acetylcholine, and histamine activates the pump. That is called active pump. After activating the pump, ACL is secreted in our body. But in first stage, the pumps are resting pump, and the pump which secreted ACL is called hydrogen potassium. The pump is called hydrogen potassium ATPase pump, and it also called proton pump. Here all the things, and the medicines are means anti-ulcer agent which reduce the acid secretion means PPI, মানে proton pump inhibitor, which inactivate our hydrogen potassium ATPase pump. Then acetylcholine means anticholinergic drug which reduce which decrease the activation of calcium ion or M2 receptor. Then histamine which decrease the activation of cyclic AMP H2 receptor antagonist. Example cimetidine, ranitidine. Proton pump inhibitor example such as pantoprazole, rabiprazole, omeprazole. All the things here. In the next portion we will discuss all the drug briefly. Now the next topic is main strategy of treatment of ulcer or peptic ulcer. Firstly, the first class of our made drug is antacid, which neutralize the acid which is present in our stomach. Various kind of antacid. Then the class of drug which decrease the acid secretion means PPI, proton pump inhibitor, pantoprazole, rabiprazole, omeprazole, etc. And H2 blocker also here which reduce the acid secretion. Example ranitidine, cimetidine. Then sucralfate. Sucralfate is one kind of drug which protect our ulcer, which protect our inner lining of the stomach from ulcer. This is the example sucralfate, and it works through protective method in the inner lining of the stomach. Now, classification of anti-ulcer agent. Classification. Firstly, gastric acid secretion inhibitor means those drugs which decrease the gastric acid secretion. The first subclass of gastric acid secretion inhibitor is proton pump inhibitor, which inactive our hydrogen potassium ATPase pump or proton pump. Example, a drug pantoprazole, omeprazole, rabiprazole, osonoprazole, etc. Then the second subclass is H2 receptor antagonist. Example, cimetidine, ranitidine. It is very important for our exam, various pharma exam. Then anticholinergic drug means pyrenzepine, telenzepine, etc. Then prostaglandin analog. Example of drug misoprostol. All the drugs are decrease the acid secretion in our body, and it is the class gastric acid secretion inhibitor. The second class is gastric acid neutralizer means various kind of antacid. It is classified into two subclasses. One is systemic and another is non-systemic. Systemic example sodium bicarbonate, sodium stearate, and non-systemic are magnesium hydroxide, aluminum hydroxide, calcium carbonate, etc. Now, the third class is ulcer protective agent, that is sucralfate, CBS, colloidal bismuth subcitrate. Then anti-H. pylori. Example amoxicillin, metronidazole, tinidazole, etc. These are the all anti-ulcer agent. In our next video, we will discuss the mechanism action of all the drugs. And if you want to learn more from our channel, please hit subscribe button to get notification of our video.